Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you the best from our pages on Sunday, April 26th. Our top story is the numbers. There are now 26,238 cases and 824 deaths across the country. The top story is that in the last 24 hours, we've seen the single largest spike of 1,834 new cases. That's in just one day. The silver lining is that 1,000 of them are limited to just two places. So while Maharashtra and Gujarat are the ones which are seeing such spike, other places seem to report an improvement. The question to ask is, are we testing enough? Now, the authorities say that yes, we just conducted 40,000 tests on Friday. However, that is still just 420 tests per million of the population. So that's something to keep in mind. The next story, and perhaps a worrying thing in Delhi, is the fact that now 2 hospitals have become hotspots or containment zone. The latest one is the Jahangirpuri hospital, where in fact 30 new healthcare workers have tested positive. In total, just in that Jahangirpuri hospital, there are 44 people who are health workers, and now it's been shut. The authorities say they may move in a different set of workers there in order to run that hospital, because this is the time you need hospitals, and that is shut. And not just that, even Bada Hindu Rao Hospital has been shut since Friday night because a nurse over there fell sick and was tested positive. The next story that we have for you is a study that's been done by Italian scientists. They've done this by collecting PM10 particles, and they found that they are able to carry COVID virus. This is especially worrying for us because of the high level of pollution that is there in Delhi. However, they don't know exactly how virulent the COVID strain remains once it's attached itself to particulate matter. So this is a study that we need to keep track of. The next story that we have are the CPWD, Central Public Works Department, guidelines that have been issued about the use of air conditioners. Now it says that ACs are safe to run between 24 degrees Celsius and 30 degrees Celsius, but it needs a certain amount of humidity, which can be provided by keeping a container or bowl of water in the room. They also point out that ACs are safe to run, home ACs are safe to run, but they can't say the same for ACs in offices and in other public places. This is especially relevant after the Wuhan study was done, which showed that while in a restaurant in Wuhan, a person who was infected didn't spread the infection among people who he was sitting next to, but rather the people who were in the line of the AC draft. So that's one interesting guideline which perhaps gives us an indication to how we should run our home ACs as well. And finally, did you know that the COVID virus is especially vulnerable for 2 types of cell in our bodies? Both of those cells are present in our noses, which perhaps indicates why we need to cover them. One, of course, is the ciliated cell, which have hair-like structures which trap and transport foreign matter, and also the goblet cells which produce the mucus. So this study and the scientists who came up with this gives us an indication and tells us the importance of covering our face. That's all that we have for you this Sunday. Keep tracking HindustanTimes.com.